So the next slide here, left ventricle versus right ventricle heart failure. And really what we're trying to do is isolate each side. Okay, so left-sided heart failure by itself, not leading to right-sided heart failure, will give you all those symptoms on the left there. So restlessness, confusion. So don't forget, there's going to be symptoms of reduced cardiac output, and there's going to be backup symptoms of blood going into the lungs. So restlessness and confusion are, I'm not maintaining my cardiac output. And one of the organs that's not going to get enough blood flow will be the brain. So the brain's going to get agitated. You'll be restless. And you'll be restless because you're short of breath too. Confused. That's reduced cardiac blood flow to the brain. And potentially you're confused because the blood is backing up into the lungs, and that reduces diffusion across the alveoli because there's fluid between the alveoli and the capillaries. So your oxygen saturation is reduced. So confusion can be for a number of causes. Orthopnea, so lying flat, causes you to be short of breath. Tachycardic, the heart is trying to beat faster because the stroke volume is lower in heart failure. So the heart beats faster to say, come on, keep your cardiac output up. So tachycardia is a common symptom of left-sided heart failure. Exertional dyspnea, when you go for a walk or you go upstairs, you get more short of breath than usual. That's the backup of blood into the lungs. Fatigue, well, you have reduced cardiac output. Patients with heart failure on the left side commonly complain of fatigue. They just don't have the energy to do things that they used to be able to do. Cyanosis, well, that has to do with oxygen not being able to cross from the alveoli to the capillaries to oxygenate the blood that can then go to the left ventricle, because the blood is backed up in the lungs. So you're going to have a low O2 sat, and you're going to have deoxygenated hemoglobin, which can lead to blue lips, like in this picture, cyanosis. Tachypnea, you're breathing fast, right? You have a lot of you have a lot of fluid around your lungs, so you're breathing fast and shallow to try and get that air in and out. Blood-tinged sputum. Well, all these vessels are congested in the lungs, the capillaries, and some of them break open, and they leak blood into the tissue of the lung. And if you're coughing, you can have hemoptysis, blood-tinged sputum. Wheezes. So left-sided heart failure with pulmonary congestion also gives you wheezes. So wheezes isn't just from asthma and COPD. It can be from heart failure, from left-sided heart failure, because there's fluid all around the little bronchioles. Crackles is the sound that you hear with a stethoscope when the patient takes an inspiration. It sounds like Rice Krispies as they take a big breath, and that's the alveoli opening with fluid all around them. Coughing, patients often cough with left-sided heart failure. There's fluid all around the alveoli, which is irritating the alveoli and the bronchial tubes. Elevated pulmonary wedge pressure. So elevated pulmonary artery pressure is the same word as pulmonary capillary wedge pressure. So, and that's why the right heart starts to fail with left-sided heart failure, right? We mentioned that before, because there's increased pulmonary pressure. Paroxysmal nocturnal dyspnea. You wake up through the night. You're sleeping with 2 or 3 pillows to stay upright. because when you lie down, you get orthopnic and you wake up, paroxysmal nocturnal dyspnea, PND. You wake up through the night, acutely short of breath. Okay, right-sided heart failure. So right-sided heart failure, another term for it is cor pulmonale. And so you also have fatigue with this, because if your right side is failing, it's having a difficult time getting the blood to the lungs and then to return to the left ventricle or the left side of the heart. So you need the right ventricle to get the blood to the left ventricle. So you'll be fatigued because you have decreased cardiac output from the left ventricle since it's not receiving the blood. Increased peripheral venous pressure. Yes. So backup of blood into the venous, onto the venous side. So distended neck veins, enlarged liver, bilateral leg edema. Ascites is accumulation of fluid in your in the peritoneal cavity because of portal hypertension. It can't return the blood back to the venous system from the hepatic veins. Enlarged liver and spleen, we mentioned already. So you have organomegaly. Those two would be splenomegaly and hepatomegaly. Distended jugular veins, because the blood can't get back into the superior vena cava from the jugular veins because there's back pressure from the left atrium. Anorexia and complaints of GI distress, we mentioned that, and that's because of the congestion, the venous congestion, all in the intestinal tract. So it's difficult to eat. Your stomach's often upset. Weight gain, well, you can imagine all the swelling that's happening in your legs, ascites in your abdomen. Your organs are filling with blood and fluid because the right ventricle just won't pump them to the left side of the heart. Dependent edema, we've already mentioned that. So right-sided heart failure in itself causes all of these symptoms. And remember, right-sided heart failure is the same as cor pulmonale. You know the most common cause of right-sided heart failure, that's left-sided heart failure. The other common causes of right-sided heart failure are pulmonary conditions. So anything that causes the pulmonary artery pressure to go up will lead to right-sided heart failure. And that's often chronic pulmonary conditions like COPD, pulmonary fibrosis, things that are causing the pulmonary artery pressure to be increased. Okay, so another slide on right-sided heart failure, right ventricular heart failure. Again, stating something that's we're becoming repetitious here about what causes right-sided heart failure. Most commonly, it's left-sided heart failure. But remember, it's anything that makes it difficult for the right ventricle to pump blood to the lungs, right? So anything that causes either blockage of the pulmonary artery vessels, such as a pulmonary embolus. I have it in brackets there. There's a condition called primary pulmonary hypertension, where the vessels are just gradually getting more and more narrowed, the pulmonary vessels, and that's leading to pulmonary artery hypertension, because all these tiny little vessels are gradually getting more and more narrowed. So that's going to increase the pressure in the pulmonary artery since the blood can't get through. COPD, which is a combination of chronic bronchitis and emphysema, well, there's also little arterial, there's the blood vessels that go all around the alveoli. they're being destroyed as well, along with the alveoli in COPD. So you're losing some flow through the pulmonary vessels with COPD because of destruction of the arterioles in the lungs. So remember, any chronic lung condition can lead to right-sided heart failure. Pulmonary or tricuspid valve disease. So now we're talking about the right side of the heart. So any valvular issue, just like on the left side of the heart, if you're making the right ventricle pump harder because you have leaky valves, say you have a tricuspid regurgitation, meaning every time the right ventricle contracts, it leaks back, it regurgitates back into the right atrium. Well, that blood's just going to come right back during diastole, and the right ventricle has to pump it again. So it's doing double duty. It's working overtime, and that can lead to right ventricular heart failure. A heart attack of the right ventricle. Well, that should make sense that if you have a heart attack of the muscle of the right ventricle, then it's permanently weakened, right? And that can lead to right ventricular failure. So, and then the rest of the slide just goes through in bullet point form what happens as the blood backs up from the right side of the heart. So I think if it makes sense at this point, you can turn me off in terms of the volume, and then just look at this slide, right? So this is a bit artificial, looking just at left-sided heart failure or just at right-sided heart failure, but it's a really good way to learn, because I find often, questions and information that you get later, they ask you, well, what are the symptoms of left heart failure, or what are the symptoms of right heart failure in isolation? So this slide just repeats the signs and symptoms that happen if it's isolated to the left ventricle or it's isolated to the right ventricle. This is another slide. We had a slide not long ago with multiple circles on it explaining what can lead to heart failure. That was a pretty busy slide, a lot of information on it. This is just 6 points. Remember that if you have heart failure already, what can worsen it and put you into what we call florid heart failure? So say you're getting by at home, and 1 week you notice that your legs are more swollen, you're more short of breath, you're gaining weight, you're more fatigued, so your heart failure is worsening. So what has precipitated that? So the first one is you haven't been careful with your sodium and fluid intake. So you've been going out to restaurants, eating a lot of salty food, which has stimulated your thirst for you to drink a lot of fluid. And the increased fluid volume has now made you fluid overloaded, that to the point where your heart can't tolerate it, and it backs up. The blood backs up from the left ventricle into the lungs. And if you also have right-sided heart failure, it'll back up from there and give you more swollen legs, distended neck veins. So we're just thinking of things that what precipitated your heart failure to get worse. The second one is you've just been missing your medications. So you say you take a water pill such as furosemide every morning to remove some of your fluid volume, and you've missed it for the past 5 days. Well, that your body's going to keep more fluid, so that's a common question we ask people. Have you been compliant with your medications? Tell me about your diet in the past week. Have you been drinking more? Have you been going out to restaurants a lot? So those are definitely the top two in terms of precipitating someone into further heart failure. Development of cardiac arrhythmia. So you're going along just fine, and your heart rhythm isn't being controlled with the medications you're taking. So say, for example, you have atrial fibrillation, and your heart rate isn't being controlled. So typically we like to see heart rates between 60 and 100, and atrial fibrillation can sometimes go faster. It can go at 130 or 140. Well, someone who has heart failure already will not tolerate faster heart rates. The heart just can't put up with faster heart rates and maintain that pumping. So that can put you into worsening heart failure. Uncontrolled hypertension. So yeah, you forgot to take your pills for a week or 2 weeks or 3 weeks, and your blood pressure's gone up significantly, and this precipitates an episode of acute heart failure, because the left ventricle says, I can't pump against this high blood pressure. I'm just going to have to back up blood into the left atrium and the lungs, and etc. So any superimposed medical illness. So if you get a pneumonia, if you have to endure some kind of surgery, if you get, say, pyelonephritis, infection of the kidney, or your kidneys have some kind of an injury to them, or even sometimes it takes nothing. Sometimes it just takes someone to have a bladder infection and make them feel sick, and that puts them into worsening heart failure with a relatively minor medical illness. So, someone who develops a pneumonia, well, that's a pretty significant infection. You can see how that could definitely stress the heart in terms of the body wanting to pump more blood and maintain normal cardiac output to try and heal this pneumonia, to try and get blood there, and you're stressing the heart to try and treat the infection, or something else has happened in the body that's demanded more cardiac output, and the heart just can't maintain it. So even something stressful or upsetting can put someone into heart failure. New cardiac abnormality. So you have heart failure, and you have repeated episodes of angina, and the heart can't tolerate even those ischemic episodes, let alone having a heart attack. So and acute ischemia, such as angina or an infarct, a heart attack, could definitely put someone into worsening heart failure. So we often check all these things when someone comes in with worsening heart failure. We ask them about salt. We ask them, are you taking your medications regularly? We do an ECG to look at their cardiac rhythm to make sure it's normal for them. We check their blood pressure. We look them over for other medical illnesses. We do blood tests to check for that there hasn't been a heart attack that could have worsened heart failure. So we'll do a troponin. And sometimes we'll look at their heart with an echocardiogram to see what the chambers look like and how the valves are working. Just looking to see why the heart failure has gotten worse.